Hello everybody, it's Rachel here at Harmonia Therapies with another little video for you on how to help you during your pregnancy. One of the big things that's been happening to some of my recent pregnancy clients towards the end, so I'm talking 34 weeks plus, is they start to get something called oedemas, which is water retention. They are starting to hold on to water in their extremities, which tends to be feet, legs, hands. Okay, so if you have hit that point where you just can't keep your wedding rings on anymore, or your jewellery, and you have to take it off and not put it back on again, you are not alone. It happens to a lot of people during pregnancy. The heat during the summer really didn't help, because obviously where your body's trying to keep your temperature regulated, on top of dealing with your other bodily systems, it can get compromised. Normally there's nothing to worry about with oedemas. Okay, if you feel that pressure has built up very, very quickly and you're swelling very, very quickly, please do go and see your health visitor or your doctor. If you are getting other symptoms along with that, breathlessness, feeling slightly dizzy, again, please do go and check it out. It can be linked to other things. Normally it's not. Trust your instinct on that, and if it doesn't feel right, please seek medical support. However, for most people who have oedema during pregnancy, almost as soon as baby arrives, it goes, because our bodies are wonderful at adapting to these changes. When you've got it, and all you can wear are flip-flops, and your feet are the size of elephants, it doesn't feel quite so fun. And it's one of those things that people find a little bit comical, but actually it can be really, really uncomfortable, because as your feet and your hands swell, the pressure against your skin can be really quite painful, even to the point where bending your hand or your foot causes you pain. Okay, it's difficult on treatment of this, but I have some tips for you. Don't walk for long periods of time, because the more you're standing, the less circulation is going to your feet, because this is all about circulation. But this is dealing with your lymphatic circulation, okay, which is separate from your blood. So in order to work that lymphatic system, what we need to do is we need to do some manual drainage techniques. These are part of a different technique of massage skills, and I'm just going to teach you some little basics that you can hopefully work on at home, just to bring a little bit of easing. The differences with lymphatic drainage as opposed to traditional massages, what you're looking to affect is completely different. So we are looking to push fluid from one place to another, is the basic premise of it. This is not the same as stroking during a massage, okay, when we're working with the fascia of the system. So in order to move this fluid from one place to another, we literally push it along. So I'm going to show you as if it was my hand, okay, and my hand was swollen. Luckily enough, excuse me for clients today, my hands aren't swollen. But if your hands are swollen, we're going to kind of work a different way to a normal massage, or any self-massage that you've done before, which normally involves, if you see my one on carpal tunnel, normally involves this type of stroking, okay? Number one, you're going to have your hand and your arm supported, okay? Cushion, towel, bolster, something that takes all of that weight. And then what you're going to do, I'm going to show you from this position so that you can quite clearly see me. You are going to squeeze from the hand up. Can you see that? So I'm literally squeezing. So I like to start actually by draining with the fingers. So I start at the first finger and I will squeeze all the way down, working through the hand. You can also do this much slower, working through, and the thumb, and squeezing it through the hand. I also tend to stroke at this point as well, because there's not much tissue there in the hand to be squeezing that through. As soon as I get to this top part of the wrist, so I go underneath those hand bones here, and I'm going to be squeezing that down all the way to the elbow. So again, if I show you from this angle, then I would stroke. Again, I've got a little bit of pressure with this, not enough to make it painful, but what you tend to find is if you've got swelling in your hands and your forearms and your feet and your legs, it doesn't take much pressure for it to be painful, because all that fluid is sat in the tissues. So it looks like you're really squeezing, but you're not. It's just a tiny amount. But when you do this yourself, or you have a go yourself, you'll realise what type of pressure you can take. So if you imagine, I'm doing this exactly the same on the foot. So I've done the foot, and I've squeezed all of that out. I've drained all of that down. Each toe exactly the same. Working those metatarsals on the foot. And then when I get to the ankle, so imagine this is my lower leg, I'm going to squeeze that up. Keep squeezing that up. And then I'm just going to drain it off. If you're working on the feet and the legs, what you tend to find is you may end up going to the toilet more, because obviously that lymph has to go somewhere, and your nearest lymph nodes are on your groin. So hopefully you will wear out. How often do you do this? It really depends on how bad your swelling is. Definitely at the end of every day. Okay, so if your feet are swollen at the end of the day and you do that whole thing where you put your feet up, try and have your feet a little bit higher. Okay, not as high as you normally would, because obviously we don't want to take anything too much above the heart when we're pregnant, but keep them elevated. And if you can get your lovely partner to work on your feet and to squeeze that down through the foot and then up the lower leg, and then stroke it all the way out to the top of the leg, it can make a really big difference and take some of that pressure off, which can be really quite painful. I hope that helps. You are welcome obviously to book in to come and see me if you are local to where I am in Kent. I love seeing new pregnancy clients. I love seeing new clients, but I love seeing new pregnancy clients, and I will help you through that. And I often show people when they come to see me how to do that themselves. But for you guys who can't get to see me, you're too far away, different country, please give it a try. Hit me with some comments wherever you're watching this and let me know if it helps. Thanks for watching as always, and I'll catch up with you guys soon. Thanks, bye.